but the headline doesn't say it. But the truth is that the baby died. So E. coli is not as friendly as it may sound.
It could be friendly depending on where you find it in the body and the type of strain that you find.
As long as it has to do with the death of a patient, especially a baby, because it's one of the very serious things when a mother has a baby and the baby is not well. I mean, the whole system is infected. So what recommendations would you give from your perspective as a microbiologist?
2 nurses at an Oklahoma City hospital may have contributed to the deaths of 16 babies in the 1990s because of the bacteria found underneath their long nails. Long nails are not as hygienic as you may think and can pose concerns regarding the accumulation of bacteria and viruses. These extended nails provide a larger surface area for microorganisms to adhere to. Studies have discovered the presence of 32 different bacteria and 28 different fungi beneath long fingernails. The warm and moist environment beneath these long nails create an ideal breeding ground and living environment for bacteria and viruses. Regardless of your nail type, natural, gel, acrylic, bacteria and viruses still accumulate.
So welcome to this video. And normally I wouldn't be concerned about nurses' nails, but as long as it has to do with the death of a patient, especially a baby, as is the case in the tragic story which I'm about to release to you, then I feel like I need to share an opinion and make a video on it, because this is quite troubling. You know, when I moved to the US, one of the first things that I saw was the beautiful acrylic nails that the nurses wear on the wall. I'm like, this thing is nice. But it was also foreign and alien to me, because back in the UK, it was not the case. Like, I remember the girls, I think some of them had polished nails, but it was a transparent paint that they used, but none of them had paint. But here in the US, it's quite different. And so I had a concern about safety. Now, the concern I had was from the perspective of infection prevention, and it appears that my concerns were quite legitimate. Now, then I stumbled on this article on the Nurses Journal, and I wanted to go in deeper and read about the article. So apparently the article was originally on Kevin MD, which is like one of those credible health websites, and it says that how new nurses' nail choices led to a newborn's heartbreaking fate. So basically the baby died, but the headline doesn't say it, but the truth is that the baby died. Now, I'm not going to be able to read all of the article, but I'll definitely go through some salient points. The article says that Molly, who is a new grad, and her friends felt privileged and honored to get this job straight out of nursing school. And NICU is one of those privileged positions. It's like working in the ICU, but this one is even baby, so it's more delicate babies or more delicate patients you are working with. And so most hospitals require that you have some appreciable level of experience. Some of them will even require that you have ICU experience before working in the NICU. But these nurses obviously came out of nursing school and they had the privilege of working there, which is a good thing because they get a chance to learn right from the get-go. And it says that this was a fast-paced NICU with 2 to 4 levels. The higher the level, the higher the baby's acuity, and they were tiny, frail, with weak immune systems. Most were born prematurely and others had defects, congenital anomalies, immature lungs, and some of the babies had to be fed with a feeding tube, and some were on the ventilator because obviously their lungs were not developed or mature to be able to carry out their basic physiological activity of exchanging and all of that. So they had to be using a ventilator. Some of them had to have a tube in their nose, in their nostril, into the stomach so that they can be fed through. And it happened to be the case that this baby who died also had a tube in the nose. But let's just continue with the story, okay? Then it says that the basic cardinal rules though were to always wash your hands and keep your fingernails trimmed according to the hospital policy. Then the story goes on to say that the new nurses were fashionable, pretty and smart, but they refused to let a protocol like having short nails bother them, and management looked the other way when they saw the new grad nurses parade their glossy, long stiletto type nails. And then it goes on to talk about baby Jessie was a level 2 baby in the NICU, born prematurely, hypoglycemic, grossly underweight, and unable to feed without a feeding tube inserted through her nose into her stomach. She was frail, but she had big eyes and a hint of fine red hair. She was a beauty. Okay, so this baby is just a premature, beautiful baby with very weak immune system, obviously, had a feeding tube inserted through her nose into the stomach just so she could feed. And obviously, once the baby is premature, it means that she's very predisposed to infections because her immune system is not mature to even withstand any infection. So the least size of infection can take the baby down. Now, the story continues to say that her parents will wash their hands, gown and glove, and held their new baby close to them every day when they came to visit, with a hope and prayer for a progressing report. Each day seemed to bring a new accomplishment. Now, back in Ghana, when I used to work in the pediatric ward, one of the things I see oftentimes is how parents will come and see their newborn babies or their children when they are unwell, and the concern and compassion that they have, because it's one of the like very serious things when a mother has a baby and the baby is not well. It's like this unexplainable bond. So you can even imagine how these parents were very interested in seeing their baby fare well. Then the story goes on to say that one day her status was changing rapidly. Poor Jessie, with rapid respirations, diarrhea, rash developed on her abdomen, and she had fever, she had lethargy. Lethargy is like she became really ill. You could see that she was not responding and she was rapidly deteriorating. And then they called the sepsis protocol, which was initiated, and then labs were drawn, blood gases were done, and they even did a lumbar puncture. So the baby was deteriorating and they had to do all these investigations, and then it says that she was not even doing well. So the story continues to say that a code blue was called. The code blue rushed in, they did CPR, put the baby on ventilator support and all of that, but they couldn't bring the baby back to life. Sadly, that's a sad story. The baby died after everything that was done. The parents, the code blue, everything, the baby died. They said after what seemed a lifetime, which was a long time, the physicians pronounced her dead and sadly met her devastated parents. You can imagine. But the story didn't end there, guys. It says that an autopsy was performed and the bacteria were found. It was E. coli, and it was mandatory to report this to the CDC. So the CDC got involved, and the CDC is like the Center for Disease Control. It says that E. coli was found in the baby's bloodstream. Now, so to understand this whole process of E. coli ending up in the baby's bloodstream better, I spoke with someone who studied clinical microbiology, who also happens to be my roommate. Now, let's hear what she has to say on this matter. So, as healthcare professionals, I mean nurses and doctors, we know that E. coli is a microorganism. But where is it mainly located and how dangerous is it?
So E. coli is part of the normal flora. It's normally found in the gut of every human being. It participates and plays a very crucial role in digestion. So it's normal with that. I think that's what we know about E. coli. However, there are different strains of E. coli. They are very pathogenic strains of E. coli. So, and it depends, it depends on the strain, and it depends on the part of the body where this E. coli is found. It's
so
normally
it's
found in
the gut.
So if you find it in the bloodstream, that's a problem.
So it's normal flora, like they say, in the gut.
Yes.
So how deadly is it? What diseases can E. coli cause if it's found in another part of the body?
So E. coli can cause bloody diarrhea. I know everybody knows E. coli can cause diarrhea. It can cause chronic and acute diarrhea. It can cause bloody diarrhea. It can cause urinary tract infections. It can cause bacteremia, that's bacteria found in the blood. It can cause pneumonia. It can cause meningitis. It can cause a lot of illnesses.
So E. coli is not as friendly as it may sound.
It could be friendly depending on where you find it in the body and the type of strain that you find.
That's very interesting to know about E. coli. So in this case where they said the E. coli was found, I mean they took a swab of the nurse's acrylic nails and they found E. coli there. So they said it ended up in the baby's bloodstream. So how could it have been transmitted? How could all of this have happened? Can you tell us how could it have gotten to the nails of the nurse and how it could have gotten to the bloodstream of the baby?
Well, what comes to mind right now are different routes. The transfer of microorganisms take different routes. A main route is the fecal-oral route, because the E. coli bacteria is a normal flora found in the gut. You have a very high risk of finding E. coli in stool. So it could be that this nurse visited the loo or the bathroom and did not wash her hands properly after that.
Interesting.
Another thing too is that it could also be that the nurse contracted or was exposed to this organism while working with other patients or in other wards.
Or with other nurses.
Or with other nurses, or with other patients' family. It could be exposed. You could be exposed anywhere. Touching of the doors, touching of curtains. It could be anywhere. But with nurses, you are more exposed to poo. So, your ability to transmit these things are very fast.
I mean, as nurses, we clean poop all day, every day, especially if you work on.
Well, it's not that bad for RNs, so.
But I mean, if you work in a highly dependent unit, you clean poop all day. I mean, so it could have been that the nurse got it through one of those routes. Yes.
Again, I know that it's standard protocol for health staff not to wear too long nails.
Yeah, the CDC says that they have to wear it not longer than a 1/4 inch. That's the allowed length of the acrylic nails that they can wear.
So the issue here is when you wear acrylic nails, that is for those who have worn it before, and if you have seen the structure of acrylic nails, it blends perfectly with your nails. And when you have that attachment that is a little longer than what was prescribed, you find germs and these kind of bacteria being hiding under your nails, and it's
Okay.
hard to reach these areas when you are washing your hands. Even when you're washing properly, you have to pay very close attention to your washing the nails and the bed of the nails properly.
So what best practices can nurse use in preventing the transmission of these microorganisms like E. coli and other things? Because as nurses and CNAs and doctors, you realize that you get to clean a lot of poop, and you even from other nurses and the patient relatives. I mean, the whole system is infected. So what recommendations would you give from your perspective as a microbiologist?
So because you work in an environment that is very infected,
Okay.
you have to practice very, very good hand washing techniques.
Okay.
You have to make sure you're cleaning your nails properly, because if you already have to practice it, but if you have acrylic nails, it means you have to pay strict attention to washing your nail bed, under your nails and everything very properly, very
Hand
well.
washing, okay.
Hand washing. Again, you have to practice the wearing of PPEs, wearing
Okay.
them correctly so you don't end up contaminating your PPEs.
That's very important, because the article says that this nurse failed to practice the good practice of donning the PP correctly, which is why it was transmitted.
Yeah, so the issue here is you are donning, but you are donning, and at the end of the day, you are contaminating your already cleaned PPE that you are putting on to prevent the infection.
Do you recommend handshakes
Well, yeah.
among staff? Do you recommend it because it can transmit microbes and E. coli?
So
and all
you
that?
have to be cautious of what you do after your handshakes.
Okay.
So you can shake the hand of whoever you're shaking your hand with, but you should make sure that you always have clean hands. You can
To
sanitize your
sanitize.
hands, you can wash your hands, and you can make sure that you are donning properly at all times when you need to. Again, what I noticed from the story was that the baby was exposed to this E. coli through the bloodstream, right?
Yeah.
So it could be that this nurse maybe she was wearing a PPE, a glove or something, but it was contaminated, and
Okay.
was able to contaminate the feeding tube of this baby. And for an immunocompromised population like preterm babies, the least microorganism that you expose them to,
Severe
the severe
complications.
complications that results from that.
So thank you for sharing your professional views with us.
You're welcome, and do give him a subscribe. He's doing a very good job.
Okay, thank you. Not me, but you heard what I just said. Remember to subscribe to the channel and like the video.
Very
Please.
educative content.
Thank you. Please keep watching. Oh my God, look at that. And the story or the article corroborates this claim. I think that various hospitals have policies and protocols on the kind of nails you have to wear and all of that. But let's start with what the CDC says. Now, the CDC has this lengthy article on workplace hygiene, and in it, there is a portion dedicated to fingernails and artificial nails. And there it says that natural nail tips should be kept 1/4 inch in length. Then it goes on to say that artificial nails should not be worn when having direct contact with high-risk patients. So the natural nails should be 1/4 inch, which we got that. And then artificial nails, when you are on a regular med-surg floor or on orthopedic floor or ER, you can wear it. Like in an ICU or the NICU or the operating room OR, you are not supposed to wear it. Like you shouldn't wear it at all. But in this case, the new nurses, I don't know, for whatever reason, chose to wear it, and somehow they got away with it, which led to the sad death of the baby. And it's a wonderful article that I think most people will be interested in reading. It even goes on to say that a growing body of evidence suggests that the wearing of artificial nails may contribute to transmission of certain healthcare-associated pathogens, and healthcare workers who wear artificial nails are more likely to harbor gram-negative pathogens on their fingernails than are those who have natural nails, both before and after hand washing. Therefore, artificial nails should not be worn when having direct contact with high-risk patients. And this is what the CDC is saying in the US. But when you go to the UK, look at this article from solent.nhs.uk. It says that staff providing critical care must not wear nail varnish or nail art whilst on duty. Fingernails should be kept short and clean. The wearing of false/acrylic/gel nails, nail varnish, and nail adornments, like even painting your nails with normal nail paints and nail polishes, by staff providing clinical care is strictly forbidden, as they pose infection prevention and control risk and a health and safety risk. Guys, you see how strict it is. And it makes sense why in the UK I never saw any nurse wear that at all. Now, it doesn't give respect to whether you are on a med-surg floor, you are on orthopedic floor, you are on ICU, you are in emergency department. No, once you are a nurse or you are a clinical caregiver, you are a carer, a doctor, once you have contact with patients, of any kind, regardless of the level of acuity, you are forbidden from wearing it. And it says strictly forbidden. It even goes on to talk about hair. It says hair must be clean and well groomed, and for staff providing clinical care, the hair must be off the collar and a style that does not require frequent readjustment. Keeping hair off the collar reduces the incidence of bacterial growth around the collar areas. On uniform, staff must have their hair tied back if longer than the shoulder length. But in the US, you see nurses with their long hair on their shoulder, and it's nice. But this article by the NHS is talking about how it causes infection and bacterial growth and all of that. It's all for the safety of the patient, but I mean, for a baby, you can imagine the devastation of the mom and the dad. I mean, how long it takes for people to have babies and then they end up in the NICU, and then something as avoidable as infection that's transmitted from the nurse because of non-adherence to protocols by the hospital is really devastating and a sad thing. So guys, I've shared my opinion on this devastating matter through this video, and I know most of you nurses and doctors also have an opinion, and I'll be glad if you are kind enough to share your opinion in the comment section, and I'll be in the comment section reading it and responding to as many comments as I can. But in the meantime, thank you for watching this video, and I'll catch you in the next one.